Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 1. Focusing on physiology. Let's get started with question number 1. For the following case, which of the following is the most likely cause of this patient's symptoms? A. Diffusion impairment. B. Hypoventilations. C. Left to right shunt. D. Right to left shunt. E. Ventilation perfusion mismatch. The case scenario is: a 32-year-old man is brought to the emergency department with severe dyspnea. His past medical history is unknown. An arterial blood gas analysis shows the partial pressure of oxygen in his arterial blood to be 62. The partial pressure of oxygen in his alveoli is calculated to be 71. The question is: which of the following is the most likely cause of this patient's symptoms? Your options are: A. Diffusion impairment. B. Hypoventilation. C. Left to right shunt. D. Right to left shunt. E. Ventilation perfusion mismatch. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is B, which is hypoventilation. This question is designed with the focus to assess your ability to make a diagnosis. The partial pressure of oxygen in the alveoli normally is 104. Incoming systemic venous blood typically has a partial pressure of oxygen of 40. Blood partial pressure of oxygen normally reaches the partial pressure of oxygen in the alveoli by the time it passes through the first third of the alveolar capillaries due to a high rate of oxygen diffusion through the respiratory membrane. When this oxygenated blood then enters the left atrium, its partial pressure of oxygen drops to 100 due to the addition of deoxygenated bronchial blood that drains directly into the pulmonary veins, bypassing the right side of the heart. As a result, the partial pressure of oxygen in arterial blood is normally around 100. A decrease in the partial pressure of oxygen below 80 is called hypoxemia. This patient presents with dyspnea, a subjective feeling of breathlessness distinct from labored breathing, and a partial pressure of oxygen of 62, which is significantly lower than the normal value. His partial pressure of oxygen is also low at 71. Knowing the arterial and alveolar partial pressure of oxygen values allows calculation of the alveolar arterial gradient, which normally does not exceed 10 to 15. This patient's alveolar arterial gradient is 9, which is within normal limits. This indicates that his low partial pressure of oxygen is directly due to his low partial pressure of oxygen and not caused by ventilation perfusion mismatch or diffusion impairment. Possible causes of hypoxemia in the setting of a normal alveolar arterial gradient include alveolar hypoventilation or inspiration of air with low partial pressure of oxygen, example at high altitude. Hypoventilation is common in patients with suppressed central respiratory drive, example, sedative overdose, and sleep apnea, or those with diseases that decrease the inspiratory capacity, example myasthenia gravis, and obesity. If you choose any option other than B, you are wrong. Let's briefly discuss the other options. A. Diffusion impairment. Gas diffusion is impaired in diseases that cause thickening of the alveolar capillary membranes, such as alveolar hyaline membrane diseases. Diffusion impairment causes the alveolar arterial gradient to be increased as there is a normal concentration of oxygen in the alveoli that cannot be transported into the blood. C. Left to right shunt. A left to right shunt occurs when arterial blood is shunted into the venous circulation. Because arterial blood is better oxygenated than venous blood, left to right shunts do not lead to hypoxemia. This can occur with atrial or ventricular septal defects or a patent ductus arteriosus. D. Right to left shunt. A right to left shunt occurs when venous blood bypasses the lung and enters the arterial circulation, thus decreasing the partial pressure of oxygen. The alveolar arterial gradient will be increased. This type of hypoxemia occurs in patients with cyanotic congenital heart defects. E. Ventilation perfusion mismatch. Ventilation perfusion mismatch is a common cause of hypoxemia. Poor ventilation of well-perfused alveoli results in physiologic shunting, leading to an increased alveolar arterial gradient. Ventilation perfusion mismatch can occur in pneumonia, obstructive pulmonary disease, and pulmonary embolism. Your take-home message from this question is that there are 4 major causes of hypoxemia: alveolar hypoventilation, ventilation perfusion mismatch, diffusion impairment, and right-to-left shunting. The alveolar arterial gradient is normal with alveolar hypoventilation and helps to distinguish it from other forms of hypoxemia. Did you get the answer? Proceed to the next question by clicking above only if you've got the answer right. However, should you fail to answer correctly, it is imperative that you watch this episode again. Remember, understanding is key to progress. Unlock the secret to acing your medical exams, especially the USMLE, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.